Hello. Now today we'll discuss the this class 3 antiarrhythmic drug and class 4 antiarrhythmic drug. In the previous lecture, we have discussed this classification and class 1 drug. It is a membrane stabilizing agent, means the channel sodium channel blocker, and the anti-adrenergic drug. Today we will see the agent widening action potential. It is a class 3 drug, agent widening action potential. Okay. Now this category of drug, it blocks the potassium channel, and potassium channel, it causes the repolarization. So by blocking potassium channel, because of blocking it, prolong the repolarization. It prolong the repolarization, and it prolong the effective refractive period. Okay, so it is called as the agent widening action potential, which prolong the repolarization and the effective refractive period. Example are amiodarone, dronedarone, dofetinalide, and the ibutinalide. Okay. Now next category of drug, it is the calcium channel blocker, which block the calcium channel. We have discussed this topic also in the antiarrhythmic drug, or also in the angina pectoris drug. So again, the drug, it is the verapamil and the diltiazem. Clearly see that nifedipine, it is not used in the antiarrhythmic drug, because nifedipine, it causes the reflex tachycardia, and hence it is used, does not use in the this antiarrhythmic drug. This question is also asked in the GPAT examination. Okay, so which why this nifedipine is not used, because it causes the reflex tachycardia. Now we'll see the first category. Now third category, it is the class 3 antiarrhythmic drug. The characteristic action of this drug is the prolongation of repolarization. By prolongation of repolarization, it blocks the potassium channel. So again, you go through that of the action potential, and means in this phase. Okay, now class 3 block this potassium channel, and by blocking the potassium channel, it causes the increase in the it prolong the repolarization. Due to that, it prolong the repolarization, and this effective refractive period, phase 0 to phase 3, due to that it is increases. So simply, in if you ask the mechanism, you must draw this action potential diagram. So prolongation of repolarization, action potential is widened, effective refractive period, it is increased. The tissue remains refractory. Refractory means it does not causes the any action potential even after the full repolarization. Re-entered arrhythmia are terminated. It is one of the action of antiarrhythmic drug. Re-entered, I have already discussed this point. Re-entry means entry through that of the one of the in the Purkinje fiber. It is a re-entry. It is occur, and due to that, it causes the tachycardia, and hence due to that, this prolongation of repolarization, this re-entered arrhythmia are terminated. And amiodarone, this is the one of the category class 3 category important drug. It is the amiodarone. It is this unusual iodine containing highly lipophilic long acting antiarrhythmic drug. So it is simply, you understand that it is the iodine containing highly lipophilic long acting antiarrhythmic drug. It is called as the amiodarone. Now it prolong the action potential duration. Action potential duration means phase 0 to phase 4. It prolong the action potential duration. It prolong the QT interval uh, due to blockage of delayed rectified potassium channel. It block the potassium channel. Okay, and due to that, it prolong the action potential duration. Along with that of the it block the potassium channel. It also block the inactivated sodium channel, just like a lidocaine. Okay, so it block the inactivated sodium channel with relatively rapid rate of channel recovery, more effective in decreasing the conduction in cell that are partially depolarized or have longer action potential duration. So it block the sodium channel, and hence conduction it is blocked. This drug also inhibit the myocardial calcium channel, and also has the non-competitive beta adrenergic blocking property. Means along with the potassium channel, it blocks sodium channel, it blocks calcium channel, it also block the beta adrenergic blocking property, and it also alter the thyroid function, because this is the iodine containing drug, and hence it alter the thyroid function. Okay, and because of this multi-channel blocker drug, it is called as the and it is a long acting antiarrhythmic drug, and hence it is used in the treatment of the prophylactic. Okay, it is used as a prophylactic drug called as the amiodaron. So it has the multi-channel blocker with some additional activity. Conduction, it is slow, means conduction from SA node to AB node, it is slow. Ectopic automaticity means fall generation of impulses from the SA node, it is markedly depressed. Okay. Now see the pharmacokinetic. It is incompletely and slowly absorbed from GIT tract. On daily ingestion, action develops for the several days or even week. It accumulates in the muscle and fat from is slowly released and metabolized in liver by this enzyme. Uses, it is used in the ventricular and supraventricular arrhythmia. Okay, this term is we have already discussed. Ventricular and supraventricular tachycardia. Supraventricular means above that of the ventricle. Okay, supraventricular arrhythmia including PSVT, paroxysmal supraventricular tachycardia, nodal and ventricular tachycardia, atrial flutter, and the atrial fibrillation. These are used in the wide range, and hence it is called as it is a long acting antiarrhythmic drug. And because of it has more action, because it blocks potassium channel, it also blocks sodium channel. It is used as a long important drug. Long duration of action made amiodarone suitable for chronic prophylactic therapy. This is very important one. Because of long duration action, it is used as a prophylactic therapy. Apart from the propranolol, it is the only antiarrhythmic drug which is long-term found reduce the cardiac death. If you give the prophylactic use, it can reduce the sudden cardiac death of the patient. Because of high and broad spectrum efficacy and relatively low pro-arrhythmic potential. Pro-arrhythmic means this drug does not cause the arrhythmia. Okay, and amiodarone is commonly used antiarrhythmic describe of organ toxicity. This drug has the organ toxicity because it alters the thyroid function, but it is the commonly used drug despite of the oral toxicity. Adverse drug effect, dose dependent, and increase with the duration of the therapy. Fall in blood pressure, bradycardia, decrease in heart rate, myocardial depression on the IV injection, and the drug accumulation. Nausea, vomiting, GIT upset may attend the oral medication during the loading dose. Photosensitization means just like when sunburn like infection, sunburn like skin pigmentation occur about the 10% of the patient. Now this term, it is the corneal micro deposit. Now what is by corneal micro deposit? It is the secretion of this amiodarone drug uh, by the lacrimal gland. This lacrimal gland secrete this amiodarone drug with accumulation on the corneal surface. Accumulation on the corneal surface called as the corneal micro deposit. Means this drug, it is deposited in the cornea, and hence it is called as the corneal micro deposit with long-term use. And it called as the headlight dazzle, just like a headlight, it is occurring that of the your eyes, you cannot see the image. It is called as a headlight dazzle, and are reversible on the discontinuation. Now, next important adverse effect is the pulmonary alveoli and the fibrosis. Now, what do you mean by this? It is the inflammatory lung disorder characterized by abnormal formation of fibrous tissue. There is a abnormal formation of the fibrous tissue between the alveoli and the duct of the lung. Okay, it is called as the TIS, means it is the inflammation of that of the pulmonary and fibrosis. आपण मराठीत काय म्हणतात, टणक होणं, ठीक आहे ना. इट इज द मोस्ट सिरियस टॉक्झिसिटी and it is after the prolonged use. Peripheral neuropathy is also occur. Now this amiodarone, it interferes with the thyroid function and inhibit the peripheral conversion of T4 to the T3, and it also interaction with the this, and hence it causes the goiter, hypothyroidism is developed. Okay, this is the major side effect of this a drug. Amiodarone causes the goiter because it interfere, because it is the iodine containing drug, and hence interfere with the function, and hence it causes the this goiter. Now next drug, it is the donadiron. It is a recently introduced, not but only difference in that of the amiodarone and donadiron, it is a non-iodinate container of amiodarone. It is iodinate and it does not contain the iodine group. Hence, it is a non-iodinate container of the amiodarone and is less toxic but is less effective than class 3 antiarrhythmic drug. It is limited to the supraventricular arrhythmia. Okay, and maintenance of sinus rhythm, stable patient of paroxysmal atrial flutter. Just like that of the amiodarone, it also block the potassium channel, it also block the sodium channel, it also block the calcium channel. But only difference, you must understand that only difference, it does not contain the iodine group. It is the non-iodinated container, and also the beta adrenergic property, it is more than that of the amiodarone. Same that it increases the action potential duration, effective reproductive period, and the slow AV conduction. Now, what is difference again? The side effect, the iodine side effect. You cannot see the iodine related side effect. It causes GIT disturbances, bradycardia, means decrease in heart rate, weakness, cough, dermatological reaction. It prolong the QT interval, but risk of toxicity point, it is low. Hypothyroidism, pulmonary fibrosis, and peripheral neuropathy does not occur. This must be, you must understand that it does not contain the iodine, and in these three side effects it cannot be seen in the case of dronediron. It is the contraindicated in CHF second and 30 AV block. Okay, this is called as the class 3 drug which block the potassium channel. Okay, now we'll see the class 4 drug. Again, this class 4 drug, it inhibit the calcium channel. So simply again, you can see that, again you can use that this calcium channel block drug block this class relative phase. Okay, so it class calcium channel blocker drug class 4, it block the this channel, calcium channel, and this calcium along with that of the sodium, which causes the depolarization. So the depolarization is inhibited by the inhibiting the calcium channel. Inhibit the calcium mediated slow channel inward current. Calcium channel blocker, it is most prominent cardio. It block the L type of calcium channel. Now calcium channel, it is three type: L type, T type, and N type. Okay, this calcium channel, it is three type. It is L type, T type, and N type. So this L type, it block the this question also in the GPAT examination. It block the L type of calcium channel. Okay, now T type, it is present in the thalamic neuron. Okay, now this T type, it is present in that of the thalamic neuron, which is blocked by the this ethosuximide drug. Only it is using the anti-arrhythmic drug. Okay, and the third one, it is called as the neuronal. Okay, so this type of this drug calcium channel blocker, it block the L type of calcium channels. Okay, uh, it so it basic action, it is depresses the calcium mediated depolarization. It suppresses the automaticity, means impulse generation, and re-entry dependent on slow channel responses. It also block the is reduced phase 4 depolarization in SA node is reduced, resulting in the bradycardia. It decreases the heart rate. Simply you can understand that by blocking the calcium channel, it calcium mediated depolarization is inhibited, and due to that it suppresses the automaticity and the re-entry. Okay, most consistent action of verapamil is the prolongation of AV nodal effective refractive period. As a result, AV conduction is markedly slow and reentry involving AV node it is terminated. Uses it is used in the paroxysmal supraventricular tachycardia and to control the ventricular rate in the atrial flutter and the atrial fibrillation. So in that you must understand that we have already discussed this class 4 this drug. Okay, so you can again add the pharmacological action of verapamil and diltiazem in that in the this PDF. Okay, so you can just write the again this information related to that of the verapamil and the diltiazem. Now again, next drug it is the diltiazem, which is the similar to that of the verapamil. However, bradycardia and depression of cardiac contractility as less as compared to that of the verapamil. It is alternative to the verapamil for termination as well as prophylaxis of PSVT. सर एक थोड़ा नंबर से 5 मिनट. It is alternative to verapamil for termination as well as prophylaxis of the paroxysmal supraventricular tachycardia for rapid control of ventricular rate in atrial flutter and atrial fibrillation. Diltiazem is preferred over verapamil because it can be titrated to the target heart rate, causes less hypotension and the myocardial depression, even in the presence of mild to moderate congestive heart failure. So this is about the class 4 drug called as the which block the calcium channel blocker. Okay. So if you have any questions, you can ask now, or you can ask in the comment chat box questions. Hello. You can ask in the chat box questions. Do you understand the topic? Those students have clear the basic regarding the this ECG, effective period, and the cardiac action potential. What is action potential duration and the what is effective period? Those students, I think, will got this topic. Okay, so go through that of the cardiac arrhythmia before the starting the antiarrhythmic drug. In the previous lecture, we had discussed the class 1 and class 2, and today we discuss the this class 3 and the class 4 antiarrhythmic drug. For the paroxysmal supraventricular tachycardia, you can use the adenosine drug and the digoxin drug. For AV block, you can use the isoprene. Okay, by from the AV conduction. An anticholinergic drug atropine, because of atropine you can use. If any question you can ask. Hello. You can ask in the chat box. Any problem? It must be a two-way communication. Okay. If you have any problem, you can ask now. or you can unmute yourself and ask question. Hello. Sharda Magar. Or otherwise say otherwise say don't problem. Okay. Hello. 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 Student understand the topic? Hello. Okay. We'll stop now.